Okay, welcome to True Health Tuesdays. Today's spinal stenosis. Now, stenosis means narrowing, but what's interesting, and there was a mistake made over 100 years ago, and I'm going to reveal the mistakes to you now because it's actually foolishness that's just been told to most people. When you look at this, I want you to get that. Spinal stenosis just means narrowing, that the canal where the cord itself goes into gets smaller. The tough part, I mean, this is what the most common cause of back pain, neck pain, things like that. Affects over 200,000 a year. But I want you to look at the structure of the disc. The disc is the toughest structure that the body has. It's 80 interconnecting rings of ligament. Now, this ligament has a very poor blood supply. Okay, it gets its nutrients through movement. And I explain how stenosis, in most cases, is protective for the spinal structures. Now, according to the medical authorities, okay, it's age-related. Your body just wears out. That's it. So if you're flexible enough, bend over and kiss your butt goodbye. Okay, now, but it's not true. Okay, because I've got patients that are in their late 90s. You know, I've got one patient that's 102, and there's no degeneration at some of their discs, and at some there is. So this is not true, but this is what's taught to most doctors. Now, and I love when you look up the data. Spinal stenosis occurs when something happens to reduce the amount. You know, and they're talking about overgrowth of bone. So does this make the sense that the body is stupid and just starts to grow bone randomly? Okay, herniated disc, thickened ligaments, spinal injuries. Well, when we look at the truth, arthritis, arth means joint, itis means inflammation. Osteoarthritis is the most common type of arthritis out there. However, it's a non-inflammatory arthritis. Okay, arth means joint, itis means inflammation. Osteoarthritis is not inflammatory, even though I just said it's inflammatory in Latin. Wait, am I the only one? Here. Here. Okay, we just called it an inflammation of the joint, but it's really not inflammatory. Okay, so this is the kind of bullpucky that's been going around for forever, and people just keep perpetuating it. Now, what I'm going to show you is that osteoarthritis is not degenerative. It's not. It's protective. It's an intelligent response by the body to stabilize unstable structures. Now, this is the Bible, okay, to biomechanics, Kirkcaldy and Willis, and they go through and they say not only is a degeneration not related to age, it's 100% related to trauma. And they're going in many elderly joints prove to be just as strong in torsion and compression as younger ones. That makes more sense, okay? That we don't wear out, that our joints keep their integrity as long as there's appropriate movement. Degenerative joints appear to be stiffer than normal but fail before healthier ones. This is a typical mechanical characteristic of scar tissue and implies injury. So this means osteoarthritis is not from wearing out, it's actually from trauma. So now we're going to look at three of the most popular types. Now, you're going to see a lot of different categories for arthritis. And the reason we're looking at arthritis is because it actually causes stenosis or narrowing. Now, this is the side view of a neck. Now, normal is just normal, okay? Grade 1 means you've lost the normal position and motion of the vertebrae, but there's no distortion of the spinal structures. There's no distortion of the bone or anything else. This is really common in acute injuries. Now, we'll see grade 1 arthritis in 3 and 4-year-olds from birth trauma. We'll see it in 50 and 60-year-olds from acute injuries. So they're not age dependent, okay? Grade 2 means that there's beginning destruction of bone. Now, it takes 3 to 5 years to see a destruction of bone or to see a change in bone. Now, if it's still not corrected, it goes to phase 3, which is more of a distortion of the bone. But I want you to pay attention to this because you'll see that the bony structures in the neck basically are about the same size and shape. Okay, does that make sense? Now, that disc gets its nutrients through movement. And I had a really fun conversation with this medical doctor who's been a medical doctor for 35 years. And I told him, I says, yeah, osteoarthritis, I wrote the book, how to cure it. And he says, oh, there's no cure, it just wears out. And I said, well, that's not exactly true, that the nutrients to that disc, if there's an alteration of movement, it can't get the nutrients, that it gets its nutrients through imbibition or through movement, okay? And so what happens is, and here I'm explaining this to this guy who's got, you know, a ton of ignorance, I mean, a ton of experience. Okay, so what happens is, if there's an alteration of movement or trauma, all the muscles lock in around it, preventing motion, because they don't want that nerve injured. Because you literally live your life through this spinal cord. If that spinal cord's injured, you start to die, and you die bad, and you could die quick. I mean, when they're you know, hanging people like in the old days, all they would do is put pressure on the spinal cord, okay, and it would shut off the cardiac and respiratory center. So this is an incredibly vital area. And it goes all the way down to the spine. This is the neck, but the same mechanism occurs in the low back, lumbar, everything, okay, thoracic area. So if there's an alteration in movement or pressure on the nervous system, all the muscles lock in, because you don't have conscious control of the muscles that run down the back half of the spine. Now, if that limits the motion, it limits the nutrients to the disc, okay? Does that make sense? Now here's where the ignorance of the medical world goes. Well, no, the nutrient of the body is going to be the same to every disc. Well, that's not true, doctor, because if you limit the motion, you're going to limit the nutrients getting in that disc. Okay? So now that disc is going to get smaller in height. So we're going to see that disc that's supposed to be here gets smaller and smaller and smaller. So do you think it becomes more stable or less stable? Less stable, yeah. This ain't rocket scientist, okay? So the body is going to distort that bone or change the shape of the bone to increase the surface area to stabilize it. And that's where how osteoarthritis is not degenerative, it's stabilizing. And typically I'll get a lot of people in here that'll say, well, you know, it runs in my family, it's old age. I go, really? You've got two perfect joints above that grade 3 area, how old are those? You know, again, you know, I mean, you got to start talking logical, because if you can inflame that joint, and inflammation is how the body actually regenerates tissue. If you can inflame that disc and restore the normal motion and position, do you think that you could regenerate it? Now, this is an interesting conversation I had with an orthopedic surgeon who had grade 3 arthritis, a reverse curve in the neck, and his hands were going numb. Wow. And he said, and of course he didn't want to do surgery because the outcome is really poor. So I said, no, seriously, where do you see the statistics on surgery? So I telling him, I've said, okay, doc, you know, we can actually, you know, regenerate the discs, you know, discs are alive. Discs are alive? Yeah, discs are alive. But you'll find out as we go through the data how the medical world doesn't understand they're alive because they can't see them growing, okay, because of their therapies. So when we look at this, you're going to hear a number of different terms, okay? A slip disc, bulging disc, herniated disc. And the way it is, remember that I want you to keep thinking of that 80 interconnecting rings of ligament. How do they get their nutrients? Because discs have a poor blood supply. They get it through movement. Okay, because if you have, say, a blood vessel, okay, going into my 5th lumbar, going right through there, if I bounce up and down or jump off a staircase, it's going to get compressed, right? So it's not a design flaw, it's a design feature of health. Normal is just normal. If you alter motion, that's going to alter nutrients to the disc. Okay, this is where spinal stenosis starts. You can have a bulging disc, which is stenosis. Again, it's going to narrow the opening where that nerve comes out, and it can also, if it's a central herniation, narrow the opening where the spinal cord is. Herniated, thinning of the disc. Now, if the disc thins, you'll see up there, it's not a really good picture, but you're going to see that the bony connection starts to distort and get longer. Because if that disc gets thin, it gets unstable, and the bone is literally going to start to change. You'll see it on the picture in the neck, how we have a normal shaped bone, but where the bone connects, it gets larger. Okay, does that make sense so far? So, and then, of course, you know, the osteophytic formation, and they call it disc degeneration. But can you see, it's called disc degeneration, but it's actually a protective mechanism by the body. So that stenosis, that bony formation, that the ignorance we're saying just occurs somewhere. No, it occurs in an intelligent layout to get that body corrected. Now what's neat is you can see it going in more degenerative fashion. It goes in the other way too. Because think of this, if you can restore motion to that, if you can cause inflammation in that, you're going to restore the nutrients, then the bone's not needed and bone spurs go away. Bone spurs literally go away. I want you to be impressed. This is an artistic model on the right, but this is the number of ligaments inside of that structure. Now, since ligaments are always being rebuilt, okay, they're always being regenerated, what would happen if you have poor nutrition? Like let's say you were getting antacids or you're taking pain relievers and you actually need to keep forming that cartilaginous ligamentous structures, okay? Would you be able to form healthy ones or maybe improper ones? Yeah, and that's what you're going to see a lot on x-rays. You're going to see people with long-term medication that the body can't reproduce the healthy ligaments, that it starts to produce an inferior model. But also, if there's any alteration in movement, and you can imagine how that has to move in each segment in order to get healthy nutrients. If it doesn't, it starts to decay fairly rapidly. Now symptoms, you're talking back pain, neck pain, buttock pain, that's the sciatic nerve, muscle weakness, impaired bladder control. This will cause cardiac arrhythmias, cardiac anomalies. See, you live your life through the nervous system. So if that area gets narrow, but what precedes the narrowing? Alteration in motion, some type of trauma, because this is not occurring because of old age. Now here's the medical solution. And what they'll do is, it's interesting. You're talking medications, physical therapy, surgery, and we're going to go through each one of these. And when you talk medications, they have a series of like where they start and where they end up. Because you don't want to start someone on mainline heroin if they have a pinched nerve, okay? Although you're going to find out that mainline heroin is a heck of a lot safer than the opioids. So you're going to start with a non-steroidal anti-inflammatory. Okay, so this is going to be the Advil, Motrin, and Aleve, okay? That makes sense. Now, of course, that doesn't work and it actually destroys joint cartilage. You're going to jump over to the muscle relaxants. Why? Because muscles must be bad, okay? Okay, then you're going to go to antidepressants, because obviously if the drugs aren't working, the muscle relaxants aren't working, and you're still in pain, it must be from drug deficiency, and if it's not, if you're still hurting, you must be crazy. So we give you an antidepressant because that'll also help with some of the pain relief. And then of course we're going to give you neuroleptic drugs or anti-seizure drugs. This is the off-label usage form. This is going to be the gabapentin and things. And then we bring out the big guns, the opioids. Okay, this is the high dose one. So let's see how, if any of this stuff makes sense. Because remember, is any of this stuff going to correct the trauma, regenerate the disc, restore the motion, and correct the stenosis? No. Okay, will it add to the stenosis? Yes. Okay. So when we look at this, the over-the-counter pain relievers, you're talking the Advil, Motrin, Aleve. 60 million Americans use it for pain relief. This is, I mean, how many times have you seen the commercial, ask your doctor if this is right for you? Okay, you know, I mean, it's like nuts. Did you know that the side effects of that Motrin, Advil, Aleve, okay, the non-steroidal anti-inflammatories, cardiovascular risk, gastrointestinal bleeding, ulcers, kidney problems, higher blood pressure. In addition to which, if you have that stenosis, you're going to have alterations of communication in that brain. So you're going to have, sensory problems, crazy. Now the American Journal of Medicine, okay, 107,000 people a year are hospitalized by taking those non-steroidals. 107,000. 16,500 die from taking it. Now, the tough part is those non-steroidal anti-inflammatories. Now think of this. That's cartilaginous and ligamentous structures we're talking about. Those drugs inhibit proteoglycan production. It's the building block of cartilage. So, I mean, if we have loss of cartilage and poor ligamentous structures, and the doctor is giving you a drug that inhibits your body's correcting that or regenerating it, does it make sense why the entire medical community is not seeing a correction of this? Because they think, yeah, hell, everybody I give a drug to wears out and it progresses. It must be a progressive disorder. No, it'll make sense now. Okay, I mean, because obviously there's something nuts there. I mean, you're talking 1.8 times more likely if you're taking the non-steroidal anti-inflammatories, okay, of cardiac anomalies. I mean, atrial fibrillation. I mean, that just doesn't make any sense. More, and this is going to be on the side effects of the avomotrone leave. I mean, all of the non-steroidals. 60% increased risk of cardiovascular problems, 25% of hearing loss, GI bleeding, GI complications, congenital heart failure, allergic reactions, 80% increase in miscarriages. And this is common. I get patients all the time, but I hurt. I took the Advil and it went away. Okay, I want your heart healthy. You know, there's a lot of other things that you can do, such as movement, ice, stabilization, heat. It's for God's sake, don't take something that can kill you. Okay, it's not worth it. Muscle relaxants. Now this is mental giant stuff. You don't have conscious control of the muscles that come down either side of the spine. So this is actually a central nervous system toxin. It attacks the base of the brain. Now it's supposed to be for calming muscles, but again, why are the muscles tight? For every 1 inch the head's forward, the pressure on the discs double. And so if you realize, like let's say you have your head in this posture, for 1 inch forward, the pressure doubles. If that head is 3 or 4 inches forward, you're talking massive pressure on the discs. So what causes degeneration in the first place? Alterations in movement. If you have excess pressure, will that continue alterations in movement and lead to a degenerative condition or a protective condition by the body? Yes or yes? Yeah, so you want to listen to the body and not just relax the muscles. Okay, antidepressants. And again, if you're in chronic pain, you're not going to be happy. And so this is an off-label usage for this stuff. 1 in 4 women are taking this. Okay, is that an overdiagnosis or what? Now, the effects of antidepressants. Now remember, we're just talking for stenosis, spinal stenosis. If you give it, it'll double your risk of bone fractures. Okay, we're talking 45% increase in fatal stroke. And again, this is just to make you comfortable because none of it is correcting the stenosis. 32% increase in heart disease. You're talking violent behavior, murder, suicide. Then we had the anti-seizure drugs. And I get this, well, it's nerve pain. It's neuropathy. Really, neuropathy, nerve pain, where's the pain coming from? Well, you know, you get this like blank stare, like my nerve must be bad. Or could it be that the opening or there's some type of spinal stenosis? When you see the solution of the stenosis, it's like, my God, how can you drug something like this? But if you're taking the gabapentin or the Lyrica, of course, am I the only one that's seen the Lyrica commercial? After that, I wanted to take it. I mean, I wanted to run through a field with flowers so bad. It just seemed cool. Okay? I don't have any nerve pain, but maybe they'll give it to me. Except when you look at it, suicidal thoughts, suicidal behaviors. For goodness sake, these people are already hurting. Memory loss, dementia. Dementia in this country costs 4 times what cancer costs. So do you think it's because of the medication use that we have? Okay, you know, and then we go to the opioids, okay? Now you do have opiate receptors in your brain. Okay, now there's the Percocet, Mama's Little Helper, okay, we got the Oxycontin, Norco, I mean this is the really good stuff. Except now look at this, 13,800 people are dying from this stuff. This is the right drug at the right time and the right dosage. Now if you take all of the illegal drugs, we're talking heroin, cocaine, crystal meth, you're talking every drug out there that's illegal that kills people. That's about 10,000 people a year die. From the non-steroidals, about 16,500, add that into the 13,800. So you're getting 3 to 4 times in just the pain relievers. We're not talking about all the other stuff. So this is not ethical or moral or scientific to give somebody these type of drugs. 700,000 emergency room visits. And this is crazy. The right drug at the right time in the right dosage for the right diagnosis. So nobody screws up here. Okay, you get a diagnosis, they come up with the medical therapy for it, they give it to you at the right time and everything. 106,000 people a year die. Okay, and this is according to, I think it's the Journal of the American Medical Society. Oh no, the Food and Drug Administration. Yeah, they're protecting you, except for the 106,000 a year that are following their advice. Okay, now let's say you decide that you've gone through all the drugs and you're still hurting. So now we're going to inject steroids. Okay, so now this deteriorates the cartilage, deteriorates the bone, weakens the connective tissue. And remember that picture of all the connective tissue on there? So a steroid injection, do you know how many people I've gotten? Yeah, I had 3 steroid shots in there and it still hurts. Can you imagine that if you understand it's a mechanical distortion that actually can be corrected, how this would like upset you? It's just mind-boggling. And what does the Mayo Clinic say about steroid injections? Steroid injections don't work for everyone, and repeated steroid injections can weaken nearby bones and connective tissue. I mean, I'm in total agreement. Why do it? We got a number of different surgery options, and when you look at the bone, the front part is called the vertebral body, the back part, the part that leads up to the spinous process, is called the lamina. So now we can carve out a little piece of the lamina, we can remove a hunk of the lamina, or we can remove the whole friggin' thing and put some metal in there. Okay, and that's the difference between the laminectomy, laminotomy, and laminoplasty. Now, how effective is surgery? Because remember, we've got stenosis, so we're just opening up and removing structures on the back half of it. 600,000 people a year go under the knife. Okay, every year. That's a lot. $600 billion, is that a good chunk of change? Yeah. But you know, if it's saving these people, that would be cool, right? Because nobody wants to be hurt. Of course, we're not correcting the biomechanics, we're not correcting the actual cause of it. 30 to 40% experience post-operative complications. That means they have some severe stuff going on through the surgery. 15% are able to go back to work in a year. Anyone good at math? It means 85% can't go back to work in a year. And they have a 75 to 80% failure rate. Okay, so any job in here, you know, you're producing $600 billion a year, you're working on 600,000 people, and 75 to 80% of them fail. Would you still be in business if you ran a car company like that? Okay. And I love the Mayo Clinic again. Some people's symptoms stay the same or get worse after surgery. Surgical risks include infection, a tear in the membrane that covers the spinal cord, blood clot in a leg vein, and neurologic deterioration. No kidding. Okay, we're going to go through the solution, but I want to show you some stupid stuff first. This is a near perfect neck on the left-hand side, little grade 2 arthritis at the base. Now, her insurance did not cover chiropractic. Now, she started with a little bit of arm pain and numbness. What doctor did she go to get the surgical opinion for this? The surgeon? You are so sarcastic, but you're right. If you go to a transmission mechanic, what are you going to get? Transmission advice, okay? Okay. So, hey, enough with that chiropractic garbage. We're just going to fix it, okay? Right. We're going to cut you open here. We're going to rip out that disc. We're going to put a steel plate and screws in there. Good as new, okay? Yep, I'd say the same thing. Okay, so now she still has the neck pain, or she still has the arm pain. Now she has neck pain too. Thank God she came back. We're able to help her. This is 13 neck surgeries on the right, 7 low back surgeries on the left. Now, well, she was still in pain, but when you look at this, the side view of the neck, we have 1 bone to work with. 1, that's it. I mean, luckily we were able to move that bone and get pressure off of her spine and headaches, but this totally alters the mechanics of the rest of her life. And I mean, think of this, surgery 5 in the neck. Hey, a couple more surgeries will have you out of pain. Surgery 10, a couple more surgeries will have, I mean, it's mind-boggling. They even came up with a billing term. It's called failed back surgery syndrome. Doc, you're going to be using this a lot, okay? He's not a surgeon, don't kill him. It's okay. And I like this because the surgeons are working in the wrong spot. According to Peter Ehrlich, orthopedic surgeon, by far the number one reason back surgeries are not effective and some patients experience continued pain after surgery is because the lesion that was operated on is not in fact the cause of the patient's pain. You're going to find out that when you get an idea for surgery, it's done with a thing called an MRI. Okay, and that's called magnetic resonance imaging. And this is a powerful magnet going around the body, facing all the hydrogen ions in one direction, and then the computer gets an impression of that. And then it gives you a picture of the computer's impression, not of what's actually happening. Now, for one thing, the patient's laying down flat on their back, so the gravitational force is going to be different, so that's going to totally distort it. You're going to be flattening out the normal curves, which will make herniated discs either appear where they're not or not appear where they are, you know, so it's totally distorted. This is an MRI in the middle of here, and again, that was done with the patient laying down. There's a similar structure on the left-hand side. The problem is, you could see there's a loss of curve. A normal curve in the neck curves and it creates an opening or a space, decreases the stress. So if anyone here is thinking, well, what would that MRI be like if the person went to extension? What if we could restore the curve? Does that make more sense? So they're working in the wrong spot. But then even here, when we're seeing that spinal distortion, what was the cause of it? This is an MRI of the neck area, but could there be a lateral deviation in the thoracic area? Could there a loss of curve? Could be there's some kind of mid-thoracic whiplash trauma, you know, because of a seat belt? You know, where's the cause? What caused this one thing to be out? Because once you find the cause, then you can fix it. I mean, we know, and I love this. I had to pull this up. The annual physical is no longer recommended by the New England Journal of Medicine and Harvard. Why? Because if you go to a medical doctor, there's an inverse relationship with the money you spend there and your health. Okay, now this isn't on physicals, this is on spinal stenosis. But can you see the medical system is not effective in correcting, assessing, or even their awareness of the problem? It's mind-boggling. So the ridiculous medical solution, because it's not a solution. I mean, drugs, steroids, or surgery. Yeah, with 80% failure rate. You want to know the real solution? Okay, anybody? Anybody? Bueller? Okay, good. One person does. Okay, if you have arthritis, fix it. Arthritis, particularly degenerative joint disease or osteoarthritis, comes from lack of motion of the joint. You restore position and motion of that vertebrae, you cause inflammation, you can regenerate it. Herniated discs, it's a ligament. Distract the joint, create a negative pressure on the inside of that disc, and that disc is going to start to regenerate. It will. They heal. I mean, I've been doing this 20 years come September. Okay, we've referred 4 people for surgery, and we're talking about 30,000 people have come through here. So surgery is necessary. You know, 4 and 30,000? I'm not good at math. Okay, spinal injuries, fix it, fix the problem. This is a brilliant design. From the front, we're supposed to be straight. From the side, we're supposed to be curved. If there's appropriate movement, I mean just appropriate movement that's going to restore the nutrients to the disc in appropriate position. This right here is a normal cervical spine, a little bit forward on the head carriage. But look at the distortion. Look at how the bones have increased their connection. They've changed their shape. Now that's called Wolff's Law. Bones lay down where it's needed. However, if you regenerate those discs, bones resorbed where it's not needed. We're looking at here, 68-year-old man. Now we're looking at degeneration here on the left. What we do here is to see if those joints are viable. Because just looking at this, you can't tell them, oh yeah, I can help you, yeah, we can regenerate it. So what we do is we'll take a stress x-ray to bend it, see if it moves, and say, yeah, we can help you. How do we know? We know the discs are still moving. Can you see this is pretty simple? You know, it does take a bit of an art. Like this one here, this is the person standing up straight, and you're looking at some deviations as the low back, but how do you tell if it's malfunctioning or if it's functioning correctly? Remember, what causes that spinal stenosis? Alteration in movement. So when you bend it off to the side, we should see a beautiful arc, and all the disc spaces should be opening up like you would see on a book, where they should be narrow on the inside, wide on the outside. Look at this one at the bottom. It's actually wide on the inside. It's bending off in the other direction. That's called a disc herniation. You can't see a disc on an x-ray, but you can see the disc motion on a dynamic stress weight-bearing x-ray. This is the best way to diagnose something, to find the culprit. And then you can actually fix it. Again, we're looking at reverse curve. And when you have a reverse curve, that alteration in motion actually creates stenosis. The more reverse of a curve, the more stenosis of that neural canal it's just choking it off. If you restore the natural curve in there, it opens up that space. It really does. We're looking at degeneration here on the left, and a complete reversal of a curve to at least 100% loss of curve on the other. Think of the distortion. Think of what's happening inside of that spinal canal on that patient. Now, of course, his body was under stress because you live your life through the nervous system. What do you think his heart was functioning like, well or poor? Yeah, really poor if he went and took the non-steroidal anti-inflammatories, the muscle relaxant, the opioids, okay, and then got a couple of steroid injections. Okay, but that's him 90 days later. And the only reason it's done is to fix it. I mean, this poor guy, you're looking at all of the drugs that he had before, and then that's him after. So it's not that it's hereditary, it's from trauma, it's from alterations of movement, and it's correctable. Again, we've got before and after. This is fun because this patient here is a teenager. And I wanted to put this up because her doctor said, wow, it's horrible, you need surgery, everything else. Okay, so I go up, and her mom wants a second opinion. So she comes in there, takes a picture, and I go, wait a second. Hon, do you got like a sore leg? Or, yeah, my knee's killing me. So I look back at this, and I look at one hip down here. So she's actually took the x-ray at the medical doctor like this and took it at our office like this, and our guys missed it when we took the x-ray. I said, dear, get back in there. Let me take a day. Lock both legs. Let's take a look. It's a miracle. We just fixed it. No, but the doctor wanted to, you know, thought she was a surgery candidate. You know, I just love that stuff. Okay, so now here's the natural pain relievers, because I don't want you suffering. For goodness sake, go to a corrective chiropractor, find the problem. That's vital. But for God's sake, don't take something that's going to blow your heart up and destroy your joints. Okay, does that make sense? See why I yell at some people? It's out of love. Omega-3s, one of the best pain relievers out there. You know, you can't overdose on this stuff. Boswellia, curcumin. Cayenne pepper. If you put cayenne pepper in a cream, like, you know, you mix it on coconut oil and put it on your skin, make sure, for God's sake, you don't have a cut. It'll wake you up. Okay, vitamin D, antioxidants like astaxanthin, ginger, bromelain. I mean, phenomenal, fresh pineapple. This is what you need. I mean, we put the same 5 thing up after each talk, but can you see now you need healthy nerve supply? If you don't, if you think you have healthy nerve supply, can you have a distorted structure? No, you got to check the structure that encases that spine, that protects it. Regular exercise, that's going to give regular movement, particularly to the joints, so your body is maintained its integrity, so it will not wear out, because joints do not wear out. Okay. Proper nutrition. This means a man makes it, you don't eat it. Absolutely sufficient rest, okay, and prayer and meditation. That's all you need. Now, at the end of this, there is a ton of references. Now, all of these references, they're going to be up on YouTube. They're going to be up on our site. Check them out. Share them. Because if you say, yeah, arthritis can be reversed, I just saw like about 5 or 6 cases, and degeneration is not from old age, it doesn't wear out, okay, they will run away from you holding their ears saying, blasphemer, blasphemer, get me my Tylenol. Okay, so I mean, it's up to us to change the world. That's the only way it's going to change. Your body's intelligent. It's designed to last at least 120 years. It's self-healing, self-regulating. Stenosis can be reversed. Okay?